Robin, I also want to let you know I wore tennis shoes with my dress pants today, and I thought of you. So,
That's
so
that's the great style choice of 2023.
I love it. It's functional. It's fantastic. I'm going to stick with it. So, I am Allison Smith. I'm the Corporate Community Wellness Coordinator for the Johnson County Park and Recreation District. And I'm one of the co-sector chairs for the Weighing In Children's Mercy Group for the Kansas City Physical Activity Plan. I'm going to popcorn on over to Matt.
Am I the only Matt? Sorry, I'm on my laptop, the Zoom just decided to bork out on me. I don't know what's wrong with it. So I'm on my phone. So I apologize. Hello. I see all kinds of people there. So I scrolled over. All right. Hey, my name is just checking. Sorry, on my cell phone doing this. My name is Matt Mann. I'm a program manager for the City of Shawnee Parks and Recreation. And I am here today to talk about our progress on our wellness hub. So
I'll popcorn for you if you can't see anybody.
oh yeah, sorry, I can't see. I'm so sorry.
Oh no, you're great. Robin, do you want to go ahead and go?
Sorry, couldn't unmute there for a second. Hi, I'm Robin Shook. I'm an associate professor at Children's Mercy. I'm the director of the Kansas City Healthy Lifestyles Collaborative. And yeah, happy to be here. I'll popcorn over to Tom.
Hi, good morning, everybody. My name is Tom Jacobs. I'm the Environmental Programs Director at Mid-America Regional Council. And I've been tracking your all's work, and I'm really curious to hear Matt's presentation today. So thanks for letting me join you.
I'll go. Why not? I'm Dr. Jamisha Wade, Executive Director at Start at Zero. I heard about these meetings through the early childhood sector. We do a lot of holistic early childhood and family development, including outdoor education. And so when I saw this pop up through Eventbrite, I said, oh, I want to see what their meetings are like and get to know some other folks working on the plan. So glad to be here. I'll popcorn to Natalie.
Hi everyone, my name is Natalie. I'm a research associate at Children's Mercy as well and part of the Kansas City Healthy Lifestyles Collaborative. And I guess Patrick.
Hey everyone, my name is Patrick Truba. I'm at Mid-America Regional Council as well, and I'm in the Transportation Department doing bicycle and pedestrian planning. Who's left? Katie, are you left?
It's me and
We got Nicole Brown.
Yeah,
All
Nicole,
right,
why don't you go first?
Nicole's here having a snack, not popcorn though. Nicole Brown, Johnson County Health and Environment. And I just wanted to say thank you to Matt for coming today. We sure appreciate it. And I primarily work on the park sector, but I have coworkers that are on the school sector and healthcare and some other places too. And the newly opening kind of epidemiology public health section also.
So I'm Katie. Oh yeah, no, just me. I'm Katie. I work with Robin and Natalie, and I offer support to some of our sector groups of the Kansas City Physical Activity Plan. So I think that's everyone. Matt, whenever you're ready, if you just want to go ahead and start.
Yeah, so good morning. And actually we're now past 12, so good afternoon. I am glad to have the opportunity to share with you all about this project that we have started here with the City of Shawnee. And I'm glad it's on Zoom today. I'm not feeling the best, so I actually was just going to stay home and be able to do it on Zoom makes it even better to be able to talk with you all. So we were talking to, it's funny, Nicole Brown had shared that you all had heard about the Community Wellness Hubs presentation from National Recreation and Park Association. And then suddenly here we were starting to seek out partners and seek out organizations within our Kansas City Metro that were interested in helping us with the Community Wellness Hub. So kind of fun to be on the ground floor of this project and to be able to give you all just an example of where we're at, very much in the infancy stage, planning stage of this. So basically, this community, this concept of a community wellness hub for us started. It's a response to several different things, different issues and things that have arisen in our community. So we began, like many organizations, we're doing and cities doing a research on through like a master plan, basically surveys, community meetings, research, demographic studies, and those things. And what does our community want, and what is their stated needs? What are they looking for over the next few years? What are our demographic studies showing? And the number one thing that came up in all of that was more adult health and wellness opportunities. We actually completed a lot of this back in 2020. And so we got those survey results, actually 2019, showing that information. At concurrently, we had a proposal that was being put together to build a recreation center in Shawnee that was going to be out in the western side of the community. And many of the other municipalities around us had those proposals that went through. Lenexa, Mission, Merriam, just around us. And so we were not just trying to keep up with the Joneses and the rep side of things, but trying to just following the kind of the example and what our research had shown back in 2019. And that proposal was voted down. And so when you look at that information, you look at all this planning and data and surveys that said people wanted more health and wellness, but they didn't want a rec center. Well, what do you do with that? So instead of just sitting on that information, we were trying to just find ways to solve that. And how do you reach that, meet that need? The other thing is, and if you like demographics, and I love looking at data and I love looking at numbers, when you look at the data of our population shift, growth and explosion in our senior population, the amount of people that are seniors that are that 55 plus or 70 plus that are going to need programming, needing spaces, needing opportunities that are catered to them, that also was included in this. Well, that's a group that when you start, how do you serve them? What do you need to do? It's a group that on fixed incomes that doesn't have maybe that's a reason that got voted down, because that was going to be a lot of extra expenses. There's a lot of things into that. So trying to weigh all those issues, coming up with a master plan. We were working on a thing that in Parks and Recreation called CAPRA, which is a national accreditation process. So developing a lot of documents and a lot of tools to evaluate things and coming up with materials. At the same time, pandemic hits, right? And we're all living through these things. So it was kind of actually a positive time for us in that we were able to lay some groundwork on where are we going from here, because the rec center was voted down. Here's all this data and information of what the public wants. And then here is all of these tools and formational documents that we've been doing these things for 25 years of existence as an organization of Parks and Rec for the city. But here we are putting a lot of these things down on paper. So it was a great opportunity to do all that. Well, my role at that time was just youth and special events. And then my position was changed to be over all the programming for from youth up to senior adults. And I still had some of the special events. So we started to, I'm a data person. I'm a research person. I love, okay, now that we have this information, what are we going to do about it? If this is what people want. So we began in 2021 building partnerships with our community organizations like Advent Health, like Athletico Health and Wellness, Athletico Physical Therapy. There are some other organizations too, Archwell Senior Health, and said, instead of a lot of times what I noticed in my time in working in nonprofits and churches and things that I've done, it's we go to those organizations and first say, well, hey, we would like a sponsorship. Like, do you have money? Can you give us money? And instead of saying, hey, can we partner together? Like, is Shawnee something that's important to you? And can we work together to combat these issues around things that you already do well? Because we are not health and wellness. We're not a hospital. We're not a physical therapist. Can you help us combat these issues? So we started in 2021 an initiative that was actually an expansion of something we already did at the city of Shawnee called Healthier Because We Work Here. The health coordinator, Pascal Bullard, and I expanded that to Healthier Because We Live Here. So we began these opportunities, free monthly wellness challenges on Facebook. We started doing a lot of free senior classes that were opportunities for them to come and get some Ask the Experts type of information. Just really, we did our first, another one that was kind of big was we did our first Falls Prevention Fair in September on the first day of fall, and partnered together to offer information, seminars, and not shooting for 500 people, but really shooting for like 50, so that these folks could have really intimate conversations and ask some of those questions that they needed answered from Advent, from Archwell, from these organizations to say, hey, I need some help, and really to be able to have some conversations rather than hand me a flyer and overwhelm me with more information. So that was another piece. So as we're building all these things and this is kind of the direction we're moving. Well, this grant opportunity came open at the beginning of, I think it was February. It was in February of 2022. And it just seemed like the perfect fit. Another piece, and I just forgot this, was so there's a program that maybe some of you all are part of called Caring for Kids. It's an organization in Kansas City that helps. It's basically a liaison between our public school system, public schools, and organizations that are in the neighborhoods around those schools to help them be able to invest back into the local school. So instead of a child leaving school with a backpack full of 50 flyers from the local churches for their Easter events, it was a way to help the churches, hospitals, for municipalities, those sort of organizations to partner together and say, we're going to really combat what's the principal seeing, what's the social worker seeing, what is the actual needs, so that we can help combat those things. And so I had just started at the Trail Ridge Middle School as the city's representative for Caring for Kids. And in that room, you have the Shawnee Mission School District, we had Advent Health, we had a couple local churches, we had these different organizations. So this grant came up, and I like to go for things. And so but before I did this, I wanted to make sure, like, I don't want to just go and apply for a grant and is nobody else going to like get behind this, right? Is this going to be a good use of time and resources? And they all loved the idea. It was just like perfect timing to line up the grant, being able to apply for that. The school district said, this sounds like a great opportunity to get behind. The Advent Health, Jeanette Metzler said, man, this is awesome. We're focused on this area. Our city was ready to go. The churches that were in that neighborhood around Trail Ridge Middle School and Lenexa, Shawnee, it's kind of on the border there, so it's kind of a feeder. Like, let's go for this. And so we put together that proposal, and it had been a long time since I've written a research paper. And so it was like putting together a master's degree paper again. But man, we had already done so much demographic studies through our master plan. At Jeanette, clearly with their community assessments that they do on a regular basis, had a ton of data about where we were wanted to focus the efforts. We had the school district, which was a major component with this grant particular, because the serving of free and reduced lunches, because we don't do that, but we do as a hub partner, the school district does. So it allowed us to apply. This was a answer to what the community wanted. Like, it was the perfect opportunity, right? And it was kind of a chance to step into our next on what we were going to do. So we applied for this grant, and I remember it was the morning of June 9th. I got the acceptance email. We were super stoked. and we've been going since then. So kind of our vision on what we're doing with our community wellness hub, different organizations are good. It's fun to see how others around the nation are kind of approaching that, and some have buildings already established, some have a whole network of things that some have already had been doing wellness hubs. Our approach is just building on these relationships that are kind of organically happening and going to the people at public events that we've already got established, but also going to our individual partners in the community, like New City Church, which is right there in the Trail Ridge Middle School area, and saying, let's work together. Let's combat some of these things, and let's deal with food insecurities. Our kind of approach is that we have 3 different ways that we're kind of tackling things through our wellness hub. One is helping community-based partners fulfill their missions and serving of areas of needs that they've identified. So Advent Health has identified the zip code of 66203 as an area of food insecurity need, and for a lot of different check boxes on areas of things of need. So that's something Advent wants to invest in, and so they've invited us in and invited others to come join them in that fight and trying to help the community. The second area is serving needs that the community identifies. So we've had started to have some conversations around this with some different folks, nothing major yet, but like if things that the community brings up and says, we have an issue with health and have a need here, or like if an apartment complex says, hey, we've got a lot of struggles with food insecurity here, is that something that you all can help us with? And so, well, absolutely. So we can reach out to the network of partners that we have, and also help just find ways to help join them, maybe do a pop-up health event for them. And finally is providing a resource page for the community to go to. So we have a trailer that's the design's getting finalized, that is going to have a big QR code on the side of it, so that any of these big events that we go to, our tents, our tables, has the QR codes, so that when people are out and getting some health screenings done, or getting learning about a quick little demo of how to prepare a healthy snack, they'll be able to scan that anytime they think about, hey, I know somebody who needs food, and then be able to scan, or hey, I remember that wellness hub, and so they're able to go to that page, and it'll have a links to all the partners, listing some of the services they provide based on demographic breakdown. And we're just starting to get that information together. This is for some organizations that are doing this. This is a full-time type of role, or a part-time type, half-time type of role. And right now it's just another thing on my list that I'm working on. So it's taken us a little bit of time for everybody in our department, because we're a really small, in Johnson County, I guess we're per capita, per 1,000 residents, we're the smallest Parks and Rec staff. So we're trying to do all these great, amazing things. It takes us a little longer, but we're getting there. So we've identified some events for this next year that are target events that we already do for the city of Shawnee, that we're going to invite Wellness Hub partners to be at, and really put on a party of health and wellness at those. Nicole Brown, actually, we are having a meeting, and we've talked about this a little bit, about doing some walk with the doc type of experiences at one of the local churches in that neighborhood with Advent Health and some others, but also do a mobile food pantry through Harvesters, and just make this big event that families and individuals can come out to and get as different types of health information and support that they need. So a lot of things are moving along, but it's hard to move this one all the way full, this one, like to complete everything's just kind of gradually moving up at the same time. So we're getting there, but we're really excited about it. I just talked to somebody the other day, brainstorming ideas of things that we can do to reinvest in our community gardens in the community, to put some money behind that. And that's the great part, is that doesn't always happen, that you have a good chunk of support like that financially, to say, hey, look, here, if we had $1,000 to help fix up community gardens that you oversee, how would that help? And just the excitement over things like that. It's just a good season. And so that's how we've kind of chosen to spend our resources and time, and kind of what our vision is over the next year, but also we view it as sustainable. So that was kind of our vision, to not just throw all that into hiring a staff person to do all this, that we would join with our partners that are already doing some of these things, that have mutual views on making the community healthier, and yeah, going at it and trying to take it on together. So there we go.
Matt, that's awesome. Have you guys met with, and I know Nicole's probably hooked you guys up with some connections over the health department. Have you guys met with the Johnson County Community Health Network at all?
So I went to, I think it was the Johnson County, I think it was the Food Policy Council, and I talked about what we were doing. I don't think I've done that one though.
Okay. If you're open to it, I would love to invite you guys to join that group. This is another group. It's Johnson County focused, not to take away from the Kansas City Physical Activity Plan, but this is Johnson County focused. And it's just, I really feel like some of the groups on there, like Advent Health is on there. Some of the other hospitals and churches and school districts and other coalitions are there. I really feel like they would have some great resources for you guys to help support your efforts for your wellness hub. Would you be open to posting your email in the chat, and or Nicole posting in there? And then that way I can send an intro email to you and Barbara, and she can get you looped in on some of that stuff.
Yeah, I will put my email in there.
Cool.
If I do it now, it's going to be awkward because I have to grab my cell phone and flip it all
Totally
around.
fine.
So we'll wait.
Totally fine. Totally fine.
Oh, Matt, we know where to find you. Don't worry.
Oh, I know you do, Nicole. I know you do. We're not at
Well-
cell phone level yet, but that probably will come
No.
soon.
Yeah,
So
I'm sure that's next. So yeah, so I can actually take care of that, Allison. That was great minds think alike. I was kind of thinking the same thing. Some of our focus with our next community health improvement plan are things like social connectedness and some other kind of more upstream things that go with, health equity and some of these other things. So I'm sure there'll be some great partners available. Although it's always good to meet new friends, you never know what you can work on. So,
Right,
and
for
I'd love
sure.
to have you kind of talk about this project a little bit too. I think
Mhm.
it'll be a fun way to garner some more support for it.
yeah, definitely. Was there any
Matt?
questions?
Yeah, Matt, this is Tom Jacobs at Mark. So first of all, your work is fantastic. It's really impressive. So, and you mentioned, so moving forward, you were thinking about getting involved in community gardens, and I could imagine other possibilities to the collaborations that were just mentioned. How would you want to grow this thing out? And what do you see as the main barriers to doing that? What's next?
So yeah, what's that?
Or what's
Yeah,
next?
yeah. So I would say with us, I would say for next is we want to, over this next year, obviously when you have a grant, we want to make sure we tick the boxes on the grant, right? Check those boxes. And so we're doing a lot of things around food insecurity, and that's going to be a big push on some of the things that we offer, some of the classes we're supporting with grant funding. But like we don't want it to just, when the grant period is up, to just say, well, that was great. That was a good time. I'm glad we really made a difference for a year. So no, I would say we see this continuing to grow as we gain partners in the community based on, and there's things that we've identified. So one of our big conversations at our meetings and in things has been that issue with the area of Trail Ridge Middle School and between Lenexa and Shawnee. But we've already started the conversation, like we have the health coordinator for all of Shawnee Mission School District on our group and our coalition that are ready, but there's a capacity of how much we can invest time wise and those kind of things to do like to do more than a couple of family engagement nights during the spring is going to be hard with the scale of us, just trying to do that. So I would say the other thing is too, we've got conversations with like USD 232 over in DeSoto, and just we've started some of that kind of conversation a little bit, just some introductions on that. But to scale up, it's going to take just calendaring and finding out who's really beyond just, well, that's a really good idea, to who's going to help us be boots on the ground. I think eventually we would see this grow. It will have to grow to have support of us having a staff person at our department that's kind of the main person at part half-time or whatever that they spend focused on growth and operations of this program, just because it really to go beyond which we could do what we're about to do this year forever. Like we could do 12 public events and we could support some of these things, but to be able to go beyond that to what it could scale up to, we would have to have somebody with some dedicated time. So I'd say just that we want. So the other thing too is, Tom, we want to do this year well. And so we want to accomplish this year well and make sure we kind of see where to scale up from here after we've done some of these things and taken visions and dreams and actually put it into reality. So let's go. We'll see after that.
Great. Is it okay if I ask another question, Katie?
Yeah.
So the reason I wanted to join today's call is I was involved in writing the Regional Climate Action Plan. And that whole, so we're talking about the intersection of health equity and climate and wellness and social equity, all these things. And in the plan, we were thinking about some concept of resilience hubs. And people use this terminology loosely. And so we were imagining, all these assets we have around the community from what you're doing in Shawnee and at Trail Ridge, or thinking about libraries or community centers or other community-based institutions. And we wondered, how is it that we can help reduce, address social environmental determinants of health, like food security, while also helping to, build community cohesiveness and ideally reduce risks associated with climate change, right? Extreme heat, flooding, and other kind of secondary and tertiary things. So, what I heard from you is a model among others that might emerge. And I wonder what thoughts you or others might have about if as we think about scaling, what kind of opportunities there might be or how we might best think about that. I'm keenly interested in this question of scaling.
Yeah, I'm not an expert because we've only just started right on this. But I'd say that's ultimately, I think we're finding that I use the phrase a lot that because like Advent Health, I wouldn't have got like that. It's a large hospital system, right? Like how do you start? Where do you start that conversation? Like who do I go to initially? And so I knew a guy who knew a guy, right? Like that somebody had the keys to help us get in there and connect with Jeanette. And now that Jeanette, she helps us network out. So it's been very organic. And I think starting from making sure we had the relational groundwork and framework in with organizations at first, rather than, hey, we want to do this amazing thing, everybody come join us. Well, they weren't on the same page. So it really helped to do some of that groundswell building up of relationship. That's what we've done so far.
That sounds right.
Around this and youth. I'm also, one of the other areas that I spend a lot of that I'm really passionate about is youth entrepreneurship and just small business support for youth. And so I've been mimicking and testing a little bit of, okay, well, I did it this way. What about if I use those same methods and that? So it's been the same kind of thing, like connecting to the right individuals. So Junior Achievement and some other ones that, man, just having those relationships and getting introduced to the right people has been really helped on growing that groundswell of support.
That's a perfect answer. I really like it. I was going to ask also if you're connected in yet to Giving Grove.
No.
It's a nonprofit that helps plant orchards around the community to address food security. They're amazing.
What?
Giving Growth, it's an entity under Kansas City Community Gardens.
Oh, okay.
And they would work with you to plant an orchard at the school, in the community somewhere. And it's extraordinary, and it would align with your issues of food, dealing with
Yeah.
food.
So when I brought up the community garden, so Claire, and I can't remember Claire's last name, she works there, and that's awesome. And we hadn't talked about that, but that would be an incredible deal, because they had some community gardens that have been started in Shawnee and probably other places, but then once the initial partners got them started, often which is sad, sometimes those people pull out and then they kind of go to disrepair. So that's that was that example. I should have said that earlier, was that we would say, hey, we would like to invest some money from this grant to restore, rebuild, renew those some of those community gardens. So yeah, but that sounds like a great one too. Thanks.
And then I'll shut up after this comment. If I could be helpful to you with other contacts at the school district, it's the DeSoto City Hall,
No.
Other places, our networks, we know those people. So I'd be happy to help with that.
That would be awesome. Yeah, for sure.
And Matt, I know back to one of Tom's first questions. I think once you guys get this up and running and you've got a good framework going, I think this would be awesome to present at one of the National Recreation Park Association conferences as a session, and or at our state KRPA conference as well, just so that way other park and rec agencies could follow in your footsteps on, hey, this is what we did, this is how we partnered with people, and these are the programs we did. Because there's so much out there, it's hard to narrow down and actually get these programs up and running with all the different opportunities.
Oh yeah, definitely. That's a great idea. And so the other, which is fun. So this is the second round of them doing this grant program. So they did it in 2020 and they had 10 or 15 pilot, and I don't know that process, how they were identified, that were national ones. And so then this second round, they had 10 new Parks and Rec division departments, and then 5 that were renewed. And so of the 10, Derby, Kansas was one of the other ones.
Yep.
And so which is amazing. So Derby, though, is a completely different approach, because they have a center, they have a staff person, it's a whole different organization, and they're doing great things too. And so that would be kind of cool to have both of us. Maybe we would do that at KRPA, like folks interested in the grant. Hey, here's how we're doing it in Shawnee and Johnson County, and this is how Derby's doing it, and like completely different models using the same wellness hub concept. So yeah, I like that. That's a cool idea.
Yeah, and if you haven't met Vanessa from Derby out there yet, I know Debbie's retiring, but Vanessa's gonna be at conference this year, and I think Debbie is too. So I know that they would probably be more than happy to talk about that, because they've presented on this subject before at conference.
Yeah.
But with everything changing and coming out of COVID and everything else, I think that this would be something really fantastic to just get a set cookie cutter. Hey, here are options that you can do in your community if you have this, or if you don't have that.
Yeah, for sure. That would be cool.
Robin, you have a question?
Yeah, Matt, thanks for the presentation. Super exciting what you guys have in the works there. My question was about, I think you mentioned something, and I'm kind of butchering what you said here, but you essentially are going to have like a resource page on your website or something like that, where you can send community members to if they need something. And I think you mentioned, like healthy eating options or something related to that. Are you guys going to create something from scratch? Do you have something already that exists and you're going to like update? Can you talk a little bit more about that?
Yep. So our city's website has a section, and I think a lot of municipalities, I want to get the wording right. So if you go to the cityofshawnee.org, There's a list at the top, residents, government, business, and then there's a button at the right that says, I want to. And so you slide under that and I want to request a burn permit. I want to, these different, have a block party. So, and then it kind of points you to these different resources. So under the umbrella of our Parks and Rec page, we've got our webmaster started to kind of lay the framework for this, but she's got the Community Wellness Hub button. When people go to that page, it will be, I want to find food. I want to find support for seniors. I want to, those kind of things. And then I'm finishing it up today or tomorrow, a survey that's going to go out to all the community-based partners that we have right now that says, okay, do you provide services for seniors? Do you provide services so that when we can link under those buttons, under those drop-down menus, hey, I'm looking for something for seniors. And then here's fitness opportunities, here's food opportunities, so that it's not us because we don't have that. It's us linking to these individuals that already do it under the branch of folks that are within our city. Now it's one of those, like, because our focus initially here with this is that it is for the city of Shawnee, it is for our residents or surrounding ones, Lenexa, the ones that we touch, Merriam, the Bonner Springs, so that folks that when they come to our things and they show up at our things, it's things that with under the umbrella of us that, man, I go to the city page and I'm deciding whether to move here. My goodness, they have all this stuff that they do under wellness. Like that it's something that that's really kind of the drive that they can go find those initial things to the site. So it's going to be under our website that we've already got and kind of fitting the same model, because that's what you have to do right under branding and those kind of things. Now, if this expands and it becomes a bigger deal, well, maybe we do a separate website. Maybe we do something beyond that. But right now, it's all going to, I think, stay under the umbrella of our what we're doing.
Gotcha. And so you're kind of trying to curate some of this information, or you'll collect it if it doesn't already exist and put it there.
Yeah. And so again, kind of with the organic mindset on that is going to be, we may miss somebody. Like if you do a search for health and wellness in Shawnee, there's all kinds of responses that you get. So we're going to start with ones that we've already established that relationship with. Nicole Brown sent me a lot of things from Johnson County Health Department. There's different things at Advent Health, those kind of things that we have that relationship. We know we can put that up there and not have to go find it. And then eventually, I think our goal is then to send something out once we kind of have a model of what that looks like. Hey, do you have activities and do you have programs for seniors that you want to list? Well, then we'll put it up on the page, and those, just to make sure we're providing those resources.
Yeah, very cool. This is like something that, like, broadly within the Kansas City Physical Activity Plan, we've been thinking about a lot is how do we, because there's a lot of people collecting bits of data, and it's being housed in lots of different places. And so we're trying to think like, how can we bring everything together so it makes sense that everyone can find it relatively easy. And if I'm missing something, that's okay because it's getting picked up somewhere else. And so we're always thinking about this stuff. So it's super cool to hear you guys thinking about it as well. And I'm curious what other people in this call, if they're doing similar things. One thing that we've identified and are thinking about a lot is there's a website called, it used to be called Aunt Bertha's, now it's called Find Help. I don't know if anyone's familiar with it. Children's Mercy has licensed like a version of it that we call Lift Up KC. Here, I'll throw the, here's findhelp.org, and I'll throw the Lift Up KC one in there. And it's like it's basically a database of a variety of social determinants of health things. So they've got food, housing, goods, transit, health, money, care, education, work, legal. And I have no idea where they get that data. I have no idea how complete it is, but I'm wondering if there's something, whether it's that or like that, that, you know, like we can get a broad group of people to get their information in there and have like everyone in a region or something like that, all being sent to this same repository.
Mhm.
So it's most complete and update. So any thoughts or comments about that?
Robin, that kind of sounds like the IRIS program that the county was doing.
Okay,
And I think Shelley, you know about that one, I think maybe. Nicole, do you
I
remember
can-
about IRIS?
I can talk a little bit about Iris.
Okay.
I think one of the differences there is that the Iris is kind of an active referral program, you know, where if somebody walked in and said, hi, I need help with, then as an Iris member, I could send a direct referral to another agency. And it gives you a way to know that somebody, it gives you, what's really great about it is because how often do we give a referral and then we have no idea what happens? So the nice thing then is part of this Iris is that then you have a way to take a peek back. You know, it kind of tracks your encounters a little bit for you. So that if I send a referral over to say a church that has a food pantry or someone else that's a member, then I can look and see when they get a referral, then they have promised that they'll actively follow up with that person instead of passively waiting to hear from them, if that makes sense. And then I can check back to see if the loop has been closed. And then you kind of know if it turns out that they decline services or you kind of know if they never return a call, you sort of know what happened. And so then when you see that person again, it kind of informs you, you know, how you can gently follow up and see what is still going on or not going on, if that makes sense. Like maybe they don't have money for their cell phone anymore, or maybe they don't have a car, so they can't get there anyway. I mean, you know, who knows? But we like it because it kind of closes the loop for you.
Yeah, oh, sorry. And I was
Yeah.
gonna say, and I know Iris has been more utilized for new families to the Johnson County area, but I know Wyandotte also did this. And then, yeah, a lot of like Johnson County Park and Rec is signed up, but we don't give a lot of referrals. And the main thing we do on there is just promote our scholarship program.
Right.
So,
Right.
yeah.
Well, and I think for some agencies, it would be more of a passive thing, but like if you're a social service agency more so, then there's a lot of back and forth on it. Like
Yeah.
some of the programs I work with are on there. And, you know, we'll maybe get a referral for our tobacco treatment specialist once in a while, or to some of our arthritis programming or some of those things. But I don't see a lot of people that I would become part of Iris, depending on which county you're in. We can help or other people can help. I mean, you could get into Iris if you want to, if you thought you had things to be referred to or from, or had people that needed referring. You know, there's a way to get in that. Don't ask me any of that part, but you know, I've got to hook up.
Thank you, Nicole, for talking about Iris.
and is that I put a website in the chat, Connect with Iris, is that what you're talking about? I see some heads nodding, so cool. I was not aware of that. I love that idea. I'd heard about that in other cities.
Yeah, and I think Iris isn't really a thing a person in the community can get on. It's more of an agency thing, if that makes sense.
Gotcha.
Correct, yeah.
But
So
then
it's
there
not-
are other resources. The county, what is that other county database too that I think people can just get on that have?
My Sidewalk.
No, the one kind of before we started doing Iris. I'll meditate on it and it'll come to me. It was more of like a database you could look at of all the things.
Yeah, yeah. I I know what you're talking about, but I do not remember the name.
And I'm
Um,
not sure if that was for everybody, but there used to be something you could even go to the library, Johnson County Library, and get on that had just lots of stuff. Like if you
Yeah.
needed help with food, clothing, shelter, whatever, So, but things change, and I have 30 years worth of stuff in my head. So it'll take me a minute to pull up the right name for that.
Thank you, Nicole.
Well, if no one has any more questions, just checking this chat really quick. Oh, yeah.
I guess
Shelley just
one
shared the-
thing I was just going to follow up with you, Matt, on in terms of as you kind of curate things, we're about ready to start a project in partnership with the University of Missouri, Kansas City Center for Nonprofit Leadership, sorry, that will it's called a physical activity mapping project. So we're going to try to identify all programs related to physical activity within the Kansas City region. And then we will house that in a publicly available data set in some way, which is why I've been thinking a lot about Find Help or Lift Up KC or whatever it may be. And so we'll have tons of information about the program, where it's at, who it serves, all that stuff. So like our goal is to make it available for things like what you're talking about. So just kind of keep us in mind. We'll keep you in mind as we go through those processes and start to find the data.
I think, yeah, and I didn't want to jump in earlier, but I thought that was really solid. Like, our page will be very Shawnee centric, right? It'll be something for somebody that maybe it's not walkable to do something over in Blue Springs, but maybe obviously it won't be. But like if there is through the project like this, maybe they move, maybe they are actually from Blue Springs and they're visiting. Maybe we could have a link to some of these larger sites like that we can send people to say, hey, maybe you're not in Shawnee, but here are some things outside of looking for something outside that we could shoot people to. It's like the Internet of Things, like where you start clicking through, right? Like, oh, I'm looking for physical fitness. Well, I live over here. There might be a way to help. I love that. I love like to be able to have some of those to solve it on a regional basis would be great.
Hey, Robin, this is your work sounds amazing. Just so you know, Mark has GIS layers for all of the parks and trails and bike routes in the metro.
Yeah, and what information is in those layers?
Patrick? Is Patrick still on? So what they are, we have a regional bike plan and a regional trail plan. And so there's a lot of, and then the files that I'm talking about are GIS shape files. So it's locational information and sort of GIS attribute kind of information. From it, you could extract other kinds of information about what it's next to and who it's serving, right? It would be, you could do analysis about, what are the populations that are adjacent to these things and talk about access or need or gaps or those kinds of things. Yeah. I might be missing something. If Patrick, if you're on, you might be able to help here. If not, we can get you more information later.
Yeah, and like I can see a great companion to that is like information, and I'll just make this up, Parks and Rec programming at a particular park. So, at, the Gillum Park, there is, I don't know, youth mixed gender kickball Tuesday nights. Yeah. From May to August or something.
Right. So that's definitely not part of our thing, but each of the city or county parks websites would have all of that. Yeah.
And so that's what I'm saying. Yeah, we'll collect all that information in our project, and then overlaying it with what the MARC database has. Yep. Yep. Yeah.
Okay, well, if there's no further questions, thank you, Matt, so much for joining us. If you want to stay on, you can. We actually only have 7 minutes left of this meeting anyway. That was really informative.
Sorry, I just got
Really
talking
good
and the
No,
second cup of
that's-
coffee kicked in. So I
It's exciting. I love your mug, by the way.
oh,
Your
it's
cat
cat,
something.
ca-
Caffeinated.
caffeinated.
it.
So I just grabbed one. So yeah.
Yes. Well, we are
All right.
down to 6 minutes, everyone. Just reading something really quick. Okay, so Natalie, did you have a question? Oh,
I
he's
did.
gone. Okay. Well, I was going to go ahead and move us along to review any implementation proposals the group might have, but it looks like we may not. We want to go ahead and sorry, I'm just reviewing this agenda really quick. We're going to pass implementation groups. We're down to group updates, but we're down to 6 minutes, but we can go ahead. Does anybody have anything that their organization's doing they'd like to share at the time this time?
Well, I don't know if it's my organization, but I did want to just pop in that there's three of us have been talking to Shelley and another sector lead. We're going to have an application going in for a project here pretty quick. Just FYI, we've talked about it in other meetings. It's going to be like a combo Girls on the Run, neighborhood stuff. So it'll be kind of a cross-sector thing. I'm not really writing it, but Lee Kurtek and Jill Rayford are working on it. And it also involves that new inclusive park in Overland Park, trying to get some stuff going. So, and the library, also the Central Resource Library, trying to get some fun stuff going so that people can utilize all those resources at the same time more easily. So stay tuned, but we'll have a cross-sector application going in time for March, the March 1st deadline.
That's exciting.
And I think that we're gonna have more applications just as the year goes on, but I just know that right now, this time of year is really hard for Parks and Rec sector folks, but I've had a few people reach out to me in regards to this because I've shared it in some of the KRPA contact groups and some of the other sites, and I'll be talking to more people about it at conference next week. But right now it's just real busy for everyone. So I'm hoping that we'll see some more in March and then in June, and then hopefully we'll get flooded with people in September. So.
And I guess I'll just, that's great. We've been clarifying like exactly the process for submitting these applications and stuff. And so Natalie, Katie, and Shelley, correct me if I say anything incorrect here, but the preferred way of submitting an application for one of these implementation projects, for those who aren't, who don't know what we're talking about, each sector has $10,000 available for implementation projects related to Kansas City Physical Activity Plan, sport or Parks and Rec sector strategies and tactics. And the preferred way of kind of moving through the process is, if you have an idea, you present it at this meeting first, and then any questions are kind of worked out among the group about the project here in consultation with the two leads, Allison and Jen. And then the application is then submitted to the core work group, or basically it's submitted to Allison and Jen, and they submit it to the core work group on a quarterly basis. So the next one is in let me pause while I look at the calendar. The next one would be need to be submitted by March 14th for review by the core work group a week later. So did I screw any of that up? Okay, does that make sense? So like if you're submitting something, basically what I'm saying is if you're submitting something for March, hopefully in February, there's some time budgeted in this meeting to kind of share your idea with the rest of the group.
We've got a lot of things going on at MARC. One of which is we're looking into opportunities to boost the level of resources and coordination around energy efficiency. So the issue here is energy burdens, especially in low-income communities, and trying to figure out how to link that to questions of home health. We're looking for grant opportunities to support that, and we'll probably have a growing agenda there. It's different from what's been discussed here, but there's a variety of points of intersection, which is why I brought it up.
It's like a hot topic right now nationally too, right? So
There is.
yeah.
And you guys over there work on that at Mercy. Kevin Kennedy does, right?
Yeah, I haven't heard any updates from Kevin for a couple years, so I don't know exactly what they've got active right now, but yeah. Historically, yeah, he's been doing a lot of great work there.
Well, it is that time. I do want to remind everyone that the next meeting is Wednesday, February 22nd. So just mark that on your calendar. I'll be sending an invite out through Eventbrite probably later today or tomorrow morning. Okay. That
This
is
was a great meeting. Thank you.
Yes, thank you for joining us. Well,
Yeah.
everyone enjoy
Yeah, great to
Enjoy.
catch up with everybody.
the rest of your afternoon. Bye.
Have a great week.
Bye.